I'm going to point out the axial portion of the bones in this video. Here is the frontal lobe. Here are the parietal bones. From the posterior view, here's the occipital bone, and this bump is known as the external occipital protuberance, and the nuchal ligaments along with trapezius muscles attach. So essentially, the vertebrae connects to the neck to support the skull. So this is what this functions as. Back to the anterior view. Right here is the temporomandibular joint. Here is the mastoid process. Here's the styloid process. Here is the external acoustic meatus. And here's the squamous part. Now, if we cut this medially and we were looking at the internal view of the temporal bone, right here we have the petrous part of the bone, which has middle and internal cavities, which have receptors for hearing and balance. Now, again, if this is medial and we're looking at the internal view, here would be the internal acoustic meatus and cranial nerves 7 and 8, along with facial, along with vestibulocochlear tissue, pass through this internal acoustic meatus. Here is the sphenoid, and here would be the superior orbital fissure. And what passes through here is cranial nerves 3, 4, and 6 allow for eye movement, so they control the eye movement. Now, if we cut this medially and we were looking at the internal view, here would be the lesser wing, here would be the greater wing, here would be the optic canal, which the optic nerves and cranial nerve 2 pass through here, and down here would be the coelotrochica, which houses the pituitary gland. That completes this portion of the video.